Can adrenal glands affect blood pressure? Some adrenal gland conditions can cause high blood pressure with serious, potentially severe complications. Adrenal glands are an essential part of how a person's body regulates blood pressure, metabolism, and immune responses. Conditions that affect adrenal gland function can significantly affect this regulation. One potential complication of adrenal dysfunction is high blood pressure or hypertension. Almost half of all adults in the United States have hypertension. In 2020, the condition caused or contributed to more than 6,70,000 deaths in the United States. This video addresses how adrenal gland function can affect blood pressure. What are the adrenal glands? A person's adrenal glands are small triangle-shaped glands at the top of their kidneys. They form part of the endocrine system, producing hormones that regulate a person's metabolism, immune system, stress responses, blood pressure, heart rate. Can the adrenal glands affect blood pressure? Adrenal glands produce several hormones that affect and control a person's blood pressure: cortisol, aldosterone, adrenaline or epinephrine, noradrenaline or norepinephrine. People can develop hypertension if their adrenal glands overproduce one or more of these hormones. Several conditions can cause people's adrenal glands to overproduce hormones, including primary aldosteronism. People also call this Conn's syndrome. Primary aldosteronism is a condition where a person's adrenal glands produce too much aldosterone, and this can cause them to develop hypertension. Pheochromocytoma. This is a rare tumor that develops in a person's adrenal gland. It leads to an overproduction of certain neurohormones, including adrenaline and noradrenaline. Cushing's syndrome. If a person's adrenal glands produce too much cortisol, they may develop Cushing's syndrome or hypercortisolism. This can cause a person to have hypertension and other symptoms. Causes and risk factors for hypertension. The following risk factors can increase a person's risk of developing hypertension: smoking, having obesity or being overweight, over-consuming alcohol, chronic stress, a diet high in fat or salt, a diet low in fiber or potassium, physical inactivity, diabetes, genetic history of hypertension. People also tend to have higher blood pressure as they age. When to contact a doctor? People with hypertension may not experience clear signs or symptoms, but the condition can lead to severe complications without adequate treatment. As a result, those with risk factors for hypertension need to receive regular checkups to diagnose the condition should it occur. Without treatment, the condition can lead to severe or fatal health problems such as heart disease, heart attack, peripheral vascular disease, angina or chest pain, heart failure, stroke, dementia, kidney disease, vision problems. Hypertension treatment. A combination of medications and lifestyle changes can often help a person manage hypertension. Medications. Doctors can prescribe medications to manage hypertension. This include angiotensin converting enzyme inhibitors, beta blockers, angiotensin 2 receptor blockers, calcium channel blockers, diuretics. Lifestyle changes. People with hypertension can often manage their condition by making lifestyle changes. A person can lower their blood pressure to typical ranges by quitting smoking if applicable, managing stress levels where possible, engaging in regular physical activity, eating a diet low in salt, limiting alcohol intake, maintaining a moderate weight. A person's adrenal glands are essential for regulating blood pressure. High blood pressure or hypertension often does not cause someone any symptoms. However, it can lead to serious health problems without treatment for management. Certain adrenal gland conditions can cause a person to develop hypertension. Doctors can typically treat these conditions, allowing people to lower their blood pressure and avoid hypertension.